Okay, good to see everyone, and thanks for having us.
But yeah, so we can get started right away. We'll do some introductions a little bit later on the presentation. But welcome to our prep pre-navigation. Thank Rachel for inviting us out to come speak to you all. Everyone, my name is Yang. I use he/him pronouns, and I've been at the HLC for the past 2 years, doing kind of assisting Renata and kind of under her mentorship, being involved in the research that she's been doing, which is heavily involved in public health.
Okay, and I'm Aubrey Arteaga. I've been at Hopkins for 5 years, and I originally started as an undergraduate intern in 2018, where I got paired. It was through KKI, and I got paired with Renata because I was interested in the PrEP and STI work that she was doing. And so now has come the time where I've passed the baton over to in terms of like the PrEP and the ES and HIV testing to Yeng, and I've taken on a position of quality management for the Ryan White Part D program here at Hopkins. And so no disclosures.
And yeah, so just got a brief overview of our learning objectives today. We're gonna be talking a little bit about the purpose of PrEP peer navigation. We'll be talking a little bit about the barriers in accessing PrEP from me and Aubrey's lens of working with the patients who have in clinic, and also understanding kind of the process that it takes to prescribe someone on PrEP and how, as navigators, how we can play a role in supporting this kind of PrEP continuum in our patients, and also helping us identify resources to connect with patients and offer them support for PrEP. And so when we talk about PrEP, it's kind of the who are PrEP navigators, and usually peer navigators are community members who are hired and trained as healthcare workers to support adherence and retention and care. And I think this really emphasizes community, right? Like how are we fostering community, educating community in order to bring that back to the community. And so I think for us, me and Aubrey, we have kind of a position where we're able to connect with the Baltimore community here in Maryland, or in Maryland. And so, for me, example, like I'm on PrEP, so I think to an extent I can kind of understand how that journey works and be able to connect that with the population here and also with my like queer identities. And in order to deliver that message to the community in ways that they can benefit from and establish a relationship with.
Yeah, and I think the highlight here is peer navigators being community members, or and so even just Yang, sharing your background and my own background, being first generation to this country, Latino, and identifying with the LGBTQ plus community, and having taken PrEP myself. Through the PrEP navigation, I really leaned on my background and to be able to share my experience and connect with clients. So just a simple visual, and we really want to just highlight just the process of kind of the PrEP continuum, PrEP cascade, from the point of being eligible, where someone is HIV negative and at risk for HIV infection, and then ultimately their adherence. And so are they taking PrEP daily as prescribed or as recommended? And so there's an opportunity here for either drop off or discontinuing PrEP, where kind of that cycle starts forward over kind of at the beginning. But what we're really trying to highlight here is, the size of these boxes. As people move along through these steps, we see people kind of fall off or change, and there's various and that's due to barriers. There's various barriers along each one of these steps, and as PrEP navigators, we're trying to identify what those barriers are. For young people, that can be very complex, and so we'll walk through some of that, but also show opportunities where PrEP navigators or peer navigators can really come in and try to prevent this drop off that we see.
Yeah, and it's great to highlight too, like kind of the purpose of PrEP is to how do we really have HIV prevention, and how do we contribute to understanding statuses and also keeping negative statuses amongst our population. And that really involves, how do we even bring these folks into testing? How do we bring testing to them and address certain barriers that they may encounter? And how do we also advocate for our patients, right? How do we kind of see them past the PrEP and engage with them in a way where it's going to build relationship and also build capacity building among our teams and among the way we interact with our community. And in that, it really allows us to bring in the education on PrEP and how PrEP can really be involved in their goal setting if that's something that they really want to do. And as navigators, we have the opportunity to also connect with them and support the PrEP initiation. How do we help them understand what the sustainability for PrEP is and how to help them adhere to PrEP medication? Which we'll talk a little bit more about these on specific sections, in the risk assessment, the initiation, sustainability, and adherence. But to get on PrEP, we have to focus kind of on the community and the goals and services that are here at Lane in order to kind of bring them in for testing and for services.
So bringing like the Peer Navigation and the PrEP navigation back to the context of the Heartland Clinic or and delivering it in a youth setting, we're really leveraging at the end of the day the resources that are available to us. And so unique atmosphere that we have at Hopkins that might not be in a rural setting, is that we have a lot of access to research and research that has interventions that promote adherence or engagement. And we've seen personally clients benefit from being engaged with a research study where they might be falling out of their clinical care, but the extra support that's offered by research studies or incentives really promote kind of some sort of engagement where clients kind of get drawn back in.
Being here at the Hero Lane and at Hopkins, I think there's a lot of resources that's kind of funneled throughout, and it gives us a great opportunity to really understand how we can really put these resources into community with the youth and also create spaces to highlight them. And then, yeah, and Aubrey talked a little about HIV and STI testing. As peer navigators, it's to our benefit to understand the different services that are happening together here at Lane Clinic. And part of that is, how do we provide access to testing through our Title 10 testing? How do we ensure youth that this is the resource that they can use for free and confidential testing, and kind of how we as navigators can really support that transition into testing. But in addition to that too, like also addressing other barriers that they might come up with insurance, connecting them to Hopkins Community Connections downstairs to sign up for insurance, having access to resources like food and diapers and pads, and kind of addressing their whole health while supporting testing. I think it's definitely worth talking a little bit about kind of the barriers of PrEP, right? And I think through our experiences, I think navigating insurance has been kind of a barrier, but also something an opportunity for us to really learn and dissect it out, so we can really relate this to patients who may need access to insurance or may have barriers in insurance. And so we're going to spend a little bit of time talking about insurance, and then also how that kind of impacts the transition into like seeing a provider, initiating you on PrEP, and kind of the cycle of what it takes to go on PrEP. So this also gives us like a idea of where navigators can really come into play, and how we can really support the team to provide the PrEP education and support for our patients. So just a little animation for y'all.
Okay, so yeah, absolutely right. I think, and we mentioned the literature mentions a place where the health navigation really has the for benefits is navigating the complexities of the healthcare system. And what's especially interesting about that is, myself being educated, working in this in the system, really, that is still a very gray, complicated area for myself. And after, with our work with other providers, at least from what we've heard, there's no curriculum in the medical school, or and someone could correct me if I'm wrong, but from what I've heard, there's no classes on how to navigate the insurance system, and really from the perspective of clients or patients. And so this has been a huge barrier with getting people not just connected to PrEP, but just engaged with care. People not knowing whether they're insured or not knowing what is covered, scared that they're going to receive a bill, and sometimes bills get sent home by error, and that creates a lot of mistrust. And so, what we're trying to focus in on here is, under this umbrella of insurance, there's these categories that we've noticed the most barriers, at least from our own experiences. And that falls into the group of who's actually insured. So, and even if someone is insured, there's kind of like this break off between the people who are insured within network, and then the people who are insured but are out of network but trying to seek sexual health services here with us. And then there's the group of that do not have health insurance, who or don't know and have never really connected with a care provider. And then ultimately there's kind of also the group, with young people who are still insured under their parents' insurance, but have concerns about their privacy and what information will be disclosed to their parents as related to their sexual health and the services that they're seeking. So just kind of specifically highlighting for the group that aren't insured, within network. So they're the people who are insured and they're in network, and I'm not sure if I'm allowed to say like priority partners for us. So that is pretty much the most straightforward engagement, getting someone engaged into care. So all really that means is helping someone get access to their My Chart, to be able to go in their My Chart and get and seek an appointment. From the back end, we can very straightforward help someone get them on the phone. Sometimes we've done a 3-way call the front desk, have them make a medical chart if they haven't been to Hopkins before. And then once they have a medical chart on the back end, we can look at the provider templates, look at the schedule, find an available time that I think, and a provider that we think could make a good connection. And then we submit that appointment request, and then that gets approved, and they have access to my chart, hopefully have access to my chart and can see that. And then they come in and they go to the registration front desk, and there's no issue. The billing gets sent fine, and that's kind of the ideal situation. When someone is insured and they're out of network, it's just a much more complicated process. And we've had experiences trying to navigate this through trial and error. And unfortunately, there's been some people, turned away at the registration desk when we weren't exactly sure what that process was. And so through over some time and experience, I think what we found to be really helpful is identifying who their primary care provider that their insurance assigns. So usually on their health insurance cards, depending, there is an assigned primary care provider. And the unfortunate part of that is that doesn't necessarily mean that they've ever made a connection or contact. And so sometimes we've come across clients that have never or don't even know who this provider is, have never been. It's all the way across town. And so what we try to do in that situation is we try to navigate making that connection with their provider wherever it is. So sometimes that means we've done the 3-way call where we call the insurance card or the primary care provider office, say that we want to help schedule an appointment, a regular well appointment for this person, and we've helped even provide transportation for them to go. And at that point, we try to counsel and kind of role play some scripts with some clients that they can go to their provider if they feel comfortable and ask them about sexual health services, ask them about PrEP, and see if that provider is willing or comfortable with providing PrEP. And because of the way that insurance works, I think that's like the best case scenario, that provider is like, yes, we have resources, you can come here for PrEP, we'll prescribe PrEP, and we'll do the follow-up, the monitoring, and then that's kind of like the happy ending there. But unfortunately, that's not what we see. A lot of providers actually don't feel comfortable providing PrEP or having these conversations with clients. We've had clients tell us that they're actually educating their provider and about PrEP and about these services. So some still oftentimes the client themselves want to come see us, or the provider doesn't feel comfortable and would prefer to send a referral. And so the referral process is a whole other trial and error that we've experienced over the years, but I think what we've come to learn is that it has really helped. The providers don't feel comfortable sending a referral until they've recently physically seen their patient. So part of our navigation is to get them ultimately connected to PrEP is linking them to a primary care provider so that they are physically seen by that provider, and then they feel comfortable sending a referral over by faxing it over to the Harriet Lane Clinic. And on this referral, it asks for a diagnosis. So providers are putting high-risk sexual behavior or exposure to HIV. It's asking which specific provider they're going to see at the Harriet Lane Clinic. And then it's also some of the referrals have even indicated whether the referral is going to include necessary labs, but not all. So eventually that referral gets faxed over to the Harriet Lane Clinic, and then that gets uploaded into the medical chart. And then the billing department processes that into and then does like a special billing for the insurance component so that at that point we can help get them scheduled for an appointment, and then they come in and hopefully don't have a problem at registration with all those kind of special circumstances. So you can see how there's a lot of room for barriers and complications in that process. And so sometimes it's even complicated when someone's insured, but it's out of network. And then the downside with the referrals is that some of them are only lasting 3 months. And so the PrEP follow-up visits are every 3 months. And so that there has been a barrier with having to go through this process every 3 months or that frequently. I don't know if it's just some referrals could be longer. I'm actually not sure, but from my experience, there's just been a lot of complications with that process. So and then the last bit, we have an in-house laboratory. So a lot of people who are coming to get PrEP at our clinic can come to their PrEP visit and then just walk out the door into our lobby and then get labs at that same moment. With those referrals, sometimes it doesn't cover the labs that we have here. And so then they need to go to like an outside party, like LabCorp or Quest or something. And so then there's the time component, transportation component, it's just, there's just so much room to fall off here. And so that's what we're trying to convey.
Yeah, and just to like add on to that too, I think it's nice for us to understand this, especially if we're trying to communicate this with our youth, right? How do we really condense this down so they can trust us to really look into their care and really kind of support them in their goals of seeking PrEP. And I think this is definitely a lot harder for folks who are not insured, right? Because we'll have to do all of this plus give them insurance. And how do we continue to support them for testing while they are trying to get signed for insurance and potentially go through all of this over again? And so when we talk about like with no healthcare coverage, the Harriet Lane Clinic is really good with connecting folks with Medicaid and signing up for insurance. And this really allows us to provide some grace period of, while we're waiting for your insurance to come, how do we access, the free clinics around Baltimore? How do we make it more convenient for you to kind of help settle your ease if you feel like you've been exposed, and to allow access to different resources that are more convenient to you while we're waiting for insurance to kind of pick up and get you started on the PrEP journey.
And really, the point here is being, there are the group of people who are still under their parents' insurance. I think it's up to age 26 where many people can stay on their parents' insurance. And so then there is the valid concerns of what information is going to be available or disclosed to my parents. And so and this is kind of also a complicated component of insurance. We have called the insurance companies ourselves to try to understand what is being sent home, what information is available. And we've had really mixed responses from nothing gets sent home to what gets sent home is just the lab visit or just it's kind of confusing. And so I'll just say here from my experience, being here for 5 years, I haven't had a situation where the client has told me that something has been sent home, but because we have that uncertainty, we try to address it the best we can in the sense of counseling and role playing script to not disclose their sexual activity or their status to their parents, but kind of be able to be prepared for a conversation that if something were to come home that kind of lets their parents know that they sought some services. They might not know what those services were, but they may find that their child is seeking these services without them knowing. And so coming up with just kind of some tool, something under their belt for them to be prepared to say. So saying that this is just telling their parents that this is routine testing that many of their peers are already getting, that these visits are regardless of sexual activity, and it could be and it's the recommended testing for this age group. And so having things like that might help kind of have a conversation or discussion to normalize and fight the stigma, because we know that sexual activity or sexual health is important for all young people, whether they're sexually active, whether they're not sexually active, we can be giving them information about just sexual health or how to use a condom or family planning in the future, and if they are sexually active, doing the testing and coming up with the plan for prevention. And so there's a huge variety that the umbrella of sexual health can kind of be covered for them to, not feel super concerned or about disclosing that to their parents.
How do we ensure that we're here to support folks seeking these services, right? And how do we really let them know, there are certain laws that you're protected against, and especially if it's with employers, because we've had folks who came to us because they didn't want their employer or their insurance companies to know, or their PCPs to know. And so I think navigating that in our scenario, just understanding, if something does happen based on the services you're taking, you are protected and we are here to support you, and to kind of expand that connection with folks coming here out of network as well.
I think the more resources we have that can get people confidential testing, like the Title 10 program, that even though there's limitations, the Title 10 program doesn't cover the PrEP labs, baseline labs, and things like that. So, but those kind of resources would alleviate some of the barriers that we're talking about right now.
Yeah, we're going to
Can I just make a notation about the Title 10 program? So our program has has just helped to make transparent, free testing opportunities through the city. Title 10 unfortunately doesn't cover the costs for any of the labs. We've just really made it clear, like, what can we send to the city health department, what can we send to the state health department for free, and making sure that there's pickups at the clinic for that.
Okay, that's really helpful to hear, and it's a complicated portion for us to understand all from our perspective.
But what Title 10 allows us to do is to see patients who are uninsured or seeking confidential care for sexual health and reproductive health. And, PrEP is so much an important part of the comprehensive, bundle of care package that a lot of our patients, might be interested and or are eligible for. So.
Yeah, that's great to hear. And we're happy to keep jumping in and put in the chat if we're speaking from our perspective as we've seen this, and so that's really helpful.
Yeah, and I think this is a good transition to kind of talk about once someone comes in, kind of what's the timeline of PrEP, and how we can really support folks in PrEP, right? So really talking about how to have these risk assessments and have youth understand their risk and motivate them to get on PrEP if that's kind of their goal, through education. And then really setting up that next stage of, okay, you're coming in for PrEP, here's kind of the timeline, answering any Q&As and ordering these labs for them to make sure that they're eligible for PrEP. And then having that 1 week follow-up to talk about the results, and to go forward with a prescription. and prescribing them for that and giving them that prescription for a month, and then as navigators, kind of following them throughout their experiences, understanding side effects that they may be having, and potentially relaying that to providers to kind of have an action plan of how do we like limit these side effects. Um, and so after that 1 month, giving them another 2 months to finish that 3 month cycle of PrEP. And at the end of that 2 month, getting HIV and STI testing done, and then every 6 months doing more labs to look at like kidney functions and seeing how feasible PrEP is for patients. And then this is kind of where the adherence part happens. And I feel like once people hit that 3 month mark, it's a little bit easier for them to kind of get a routine of putting PrEP into their routine, and kind of how we can kind of support them outside of the PrEP and addressing other barriers that may be influencing their ability to take PrEP consistently.
And bringing this back to the PrEP cascade that we talked about in the beginning, like as you can see, each one of these steps are opportunities to encounter barriers and kind of fall off or discontinue and so what we're really trying to talk about is like how can we address these barriers. And so kind of at these beginning, you can see that a lot of navigation, happens at the initial steps. We're providing the risk assessments and PrEP education with the providers or even out in the community on their own, and helping with navigating through that first provider visit, whether it's like from the background, we're helping set up that appointment, making the calls, checking the insurance, kind of, and then, we have our own personal our own work cell phones. And so trying to keep in touch with the client in between, especially that 1 week where they do the baseline PrEP labs. And it's important for us to keep in communication, have them come back, because, that HIV test, that HIV negative test that makes them eligible for PrEP is actually only good for about a week. And if that time frame goes by, then those labs need to be redone. And that is a whole barrier of getting them back in and starting the week. And so there's so many opportunities to kind of miss that window or have someone fall off. And so that the engagement and the relationship that they're having, the PrEP navigator, we hope that it encourages that engagement and that conversation. And even up to the 1 month follow-up where we're providing appointment reminders, calling in to ask if they picked up, the prescription, if they've taken it every day, if trying to assess if they've missed, in the last couple of days, how many did you take, and people sharing like what's working and what's not working, trying to come up with tools for them, either doing it like a routine, like every morning, or some people prefer it just right when they wake up or right before bed, or we've provided pill boxes that have helped some people. And the whole point of all of these steps, especially at the beginning, is we're providing that intensive navigation, and because we recognize all the barriers that it takes to get initiated to PrEP, but we're also trying to provide counseling and support clients' self-agency with what we're trying to do with setting up their MyChart is eventually showing them that they can sign in on their own. They can reach out to the provider on their own. This is how you do it. We may help the first couple times, but when we're looking at the 3 month labs and the 6 month, and what we're hoping for is sustainability, where they're taking the experiences that we had at initiation and what we've shared, and taking those and having the self-agency to attempt or even try.
I think this gives us a good transition to also talk about different types of PrEP medication, and how we can find the best option for youth so they can stay adherent to the medication.
Yeah, and then even we're talking about barriers, and so there's even barriers with among these different prescriptions. And so knowing that the generic version of PrEP that's available now is this big white clunky chalky tasting pill, and so someone who might not be comfortable or used to taking pills is going to have trouble swallowing that pill. And I've seen someone stop taking PrEP because that was what was available to them, that generic version, and they weren't able to swallow, and they just kind of gave up on it. And it was really hard to kind of engage that person after that. And then even with the Descovy, we know is a lot smaller, small, tiny blue pill, where Truvada is a little bit bigger, and then even with the injectables, the barriers that can be associated with that are the fears of needles. We see that even when oftentimes we walk people to the labs to get their blood drawn right after the appointment, just to support and make sure they get them done. And those needles, there's these big guys who are like, no, 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 I don't want to see, and so needles can be really scary.
And just like bringing back the insurance too, like I think insurance also plays a big role in different access to different types of medication, right? In terms of coverage. And so I think we're also able to kind of help provide resources and potential financial assistance to also kind of break that barrier to getting on PrEP.
And I see in the chat Dr. Marcel sharing that this can be a barrier, even not just with the clients, but with the providers themselves, not necessarily understanding the nuance of like how to prescribe these or who's giving what. And that's a barrier in itself. And we're hearing clients say that the providers don't feel comfortable doing this. And yet we encourage, or we're trying to put out and saying we, like, I think in adolescent medicine, trying to put out to empower all providers. I read this article yesterday. PrEP is a primary care provider. Like, primary care providers should feel empowered to take this and help with the prevention.
And so kind of a summary. This is a pretty long presentation, but I think kind of the meat of the PrEP peer navigation is really having that one-on-one encounter with youth, and kind of addressing some on-demand needs and for like scheduling transportation, but also to have that consistent follow-up of rapport building and just understanding where they're at and how we can really support them. And I think for me and Aubrey, it's a way for us to also stay really informal with them sometimes, inviting folks to community events, for healthcare events, even to help them stay engaged in their own community and also with the education that's happening here at Hopkins. And then also looking at encouraging sustainability. I think Aubrey you can talk a bit more about that too.
Of course, we want to also mention just kind of the challenges. And so so Yeng and I we have a lot of fun. Sometimes we're talking about these clients, we're trying to get people to come in, we're bouncing ideas. Like, a lot of this, the community that is around, we get a lot of support from our mentors and the staff here, and there's a lot of encouragement in the city. And so we feel that, and I want to highlight the importance of having those supports, because I think what doesn't get talked about often is also when we're talking about PrEP navigation, it isn't what we're doing is the end goal is PrEP, and someone tells us they're interested in PrEP and goes into that. Actually, in order to get to those conversations, we're getting to know people, and oftentimes it isn't someone being forthcoming, being like, "Oh, I'm having sexual activity and I have to protect myself." It's we're getting to know them in the community, or they're coming in and we're hearing people are sharing with us that they're becoming homeless, or that they are in an abusive relationship, or that they don't have food, and there's a lot of conversations, and we're trained to be, to listen and use our motivational interviewing skills to try to come up with goals, and then really rely on our resources to say, let's, this is kind of above us, but let's try to get you into the clinic the best way we know how. And sometimes that is through testing and whatnot. But there's, I want to mention, at least from my personal experience, when I first, and we mentioned at the beginning, peer navigators being part of the community members that get trained into this, the first couple of years when I joined on, fresh out of undergrad, this was really emotionally challenging for me to be able to kind of separate, deal with, kind of hear people's life stories and the challenges that they're experiencing, trying to engage them with prevention care. And so having those supports like the Peer Navigator Network and amongst here, and having the support from everyone, I think, on this call is really important. And I hope other navigators in different areas have that. And then just some challenges with also the on-demand services with the boundaries. We have our cell phones, and so there's also that component of trying to set boundaries. There's been times where it's like that 1 a.m. text that's really urgent, but trying to explain to clients, we have our cell phone that's available to you, but from our end, we're kind of expect a response during the weekend work hours for our personal benefit, and people are understanding of that. And then documentation and reporting. How do you, that's a requirement for our fundings, to be reporting, but there's challenges how do you report the extent of text messages? We talked about all the navigation we went over with the health insurance. How do you really report the extent of that? And it can also be sometimes burdensome, and just kind of the caseload and the follow-ups. There can be challenges with that. With every challenge, there's also success.
Yeah, and I think it's I think in all of our work, we're all very excited to work with adolescents and young adults and how to really help set them up for that transition into adulthood. And part of that is, peer navigators talking about sexual health with them. How do we get them involved in their community, so we can continue to support them in those spaces as well? How do we really target other factors that may be influencing um, their just navigation in the adult world with insurance, with resumes, with meeting other people, networking, getting jobs. We've had a couple of folks wanting to be more financially stable and kind of offering that extension to different parts of the clinic to address those needs. And ultimately, we want you to remain HIV negative. And I think that's kind of the message with PrEP navigation and really having folks coming into clinic and having these resources is so that they can remain negative and be able to kind of not worry um, about their sexual health in that aspect. And
Okay, so we also want to acknowledge, Yang and I are kind of giving this talk, but we have new navigators that you probably have worked with or will work with soon, and so we want to also highlight them here, and really we want to thank Rin Rounds here for giving us the platform to share through our eyes and our experience this peer navigation.
and also we have Dr. Fields and Renata kind of supporting our cause, but also ultimately looking at the bigger picture and how do we really cater towards our youth in Baltimore.
So we hope that was exciting or fun to listen to, and I hope you took something away from that. And it looks like we have a few minutes. We'd love to hear your thoughts.
Was a great talk, Aubrey and Yang. This is awesome. I've been doing a lot of PrEP talks recently, webinars and whatnot, and I always talk about how critical having navigators are for our youth to really help them navigate this really complex system. And you guys have really illustrated how complex it is and how much kind of on-the-job learning you guys have had to do in order to make it easier for youth. And I just think this is it's really great for us to see how this works from your perspective, because it helps us to be clear about things with our patients, and also helps us to support you all and making sure that you have the resources you need to support our patients. So this was just really, really well done and really excellent. Thank you guys.